Welcome. Thanks for joining PCR Planet on April 23rd. I'm delighted to invite you to this conversation with Dr. Mohd Ali from Kuala Lumpur in Malaysia, and we also have Andrew Ong from Sydney, Australia. Thank you for joining. So let me start with you, Rosli. Tell us a bit about the general situation in the country and in your city. Is there a lockdown? What is daily life like?
Yes. Thank you for having me, William. We are now starting our 6th week of the national lockdown. National lockdown means to say that only people doing essential services are allowed to travel out. For those others, they are asked to stay in, and if they flout the law, then they will be charged in court, not just fined, charged in court. So if you need to buy food, there's only one person from the family that will be allowed to go out. In fact, unfortunately, recently last week, my father-in-law passed away, and only my sister and her brother was allowed to travel about 400 kilometers away. So, and only 2 per person in a car, and with specific letters that they were allowed to travel. Otherwise, it's a lockdown. But it's been shown to be useful because our numbers have now come down from the heydays of close to 200. And over the last 1 week, it has been down to less than 100 or close to 50 per day now. We have had a total of about 5,500 cases and only 93 deaths. So it's been a good way of doing things, locking down.
Oh, that's great to hear. And also the fact that you are actually probably through the storm and starting to see a decrease in the number of cases. Yeah, great. And on your side, Andrew, what's the situation in big Australia?
Thank you, William, for having me on this program. Australia has been very fortunate. We've had approximately 6,500 cases of COVID-19. We've had 76 deaths to date. And we've also had a similar lockdown, but not as strict, what we call level 3 restrictions, where the food and beverage industry has been shut down. People are encouraged to work from home. People need a reason to go out. However, what we consider essential work in Australia is that anybody who has a job is an essential worker and is allowed to go to work. Schools have been closed. Fortunately, it's also school holidays. But these restrictions have been very successful. And we have now gone down to single digit for the last 2 days for the whole country, with 4 cases yesterday, 7 cases today. And so we are likely seeing the light at the end of the tunnel for Australia. But we still have to maintain the restrictions and the social distancing to continue this, I believe.
Yeah. So in a huge country like Australia, the cases that you've seen were scattered in the main cities, or was there like focus areas where you had COVID plus patients?
We were fortunate to have very good public health workers who were able to contact trace. The majority of our cases were imported by air, and there was an element of local transmission and a small element of community transmission with no known contact. But those cases have been shut down quite quickly. And so the ongoing spread within the community is minimal at this stage. And as I said, now it's almost negligible.
Turning to Rosli again, I mean, how's your daily life in terms of work? Have you worked very hard, or are you looking forward to go back to hard work?
Yeah, I'm really looking forward to go back to hard work. Our hospital is a niche hospital in the sense that it is treating purely cardiovascular patients. And therefore, with the lockdown, there have been a significant drop in the number of patients coming in, even for regular outpatient checkups. So, but we are still continue to do our procedures, surgeries, and so on. Obviously, they need to be screened first. For primary PCIs, the whole country in the very beginning, we were saying that we should have just pure lytic therapy, and only for rescue PCIs or delayed PCIs for patients after they have been screened for COVID testing. But over time, now that we are a bit more familiar and a bit more efficient with the PPEs, we're starting to do more primary PCIs. And I feel that that's a good way of doing it, because in the beginning, we take it into ourselves that we have to protect the staff as much as possible. But now with gaining confidence, we're starting to do more primary PCIs.
Yeah, thank you. I think this has been like a sort of universal observation and behavior in the interest, of course, of keeping our healthcare providers safe and well. Andrew, any special observation? I mean, you were prepared for the worst that fortunately didn't happen, but anything peculiar or specific that you've learned from this work in this environment?
We learned that I work in a general hospital with a large population of general medical patients. We also do a large number of primary PCIs and for STEMIs. And from the very beginning, we said that we would do primary PCI as our default strategy for all patients. We did multiple simulations with patients with regards to COVID. Fortunately, up until today, we've not had to treat a true COVID positive STEMI. We've had some people with upper respiratory tract illnesses who we treated as COVID. So we dressed up in full PPI, observed proper donning and doffing, and carried out the procedure. We did simulations with emergency, and yes, times were slightly longer in terms of door to balloon because of the need for assessment. But overall, it worked out very well. And I think the more we work together with our nurses, our doctors, our anesthetists, and our emergency physicians, the better we got, the more comfortable we felt with each other, and better communication really all around as an end result of this COVID pandemic. Mm-hmm. It's amazing. Yeah. The freedom was amazing that we got to talk to so many people, and we really got along with each other.
Yeah, this emphasizes the importance of the teamwork and practicing it. Also, CPR is an issue, and you need to be really trained in doing it in order to avoid important delays, of course, in starting the actual resuscitation. So that's a strong message, actually, that you're sending us. I mean, doing a primary PCI with the PPE on board is not that pleasant nor easy, right? You need to get used to it. Rosli, yeah? Did you?
Of course. What happens is that, especially when you wear the shield, there's lots of fogging and you can hardly see the screen very well. So that actually, is something that you've got to get used to. And even with the air conditioner down to about 16 degrees, you still feel warm in the clothing. So you need to just get in and out as soon as you can, because otherwise things will get really uncomfortable. So it was not easy in the beginning.
And that's also your experience, I think, Andrew. Yeah.
Absolutely. The fogging of the face shield, I think, is a universal phenomenon for all of us. It definitely made things a bit harder. Communication was a little bit more difficult through the N95. But as we did simulations and as we did more cases who were fortunately COVID negative, even though we thought that they were possibly positive, we learned a lot along the way and learned to communicate better.
It was absolutely great to hear from you. We're delighted to see that you're well and that you're doing, of course, a fantastic job in helping the community and facing this massive threat. So we're going to conclude this conversation, but I'd like you to share, if you wish, a key learning, a statement, or if you want to share some personal experience, please do it now. I'll start with you, Andrew, and then I'll turn to Rosli.
Thanks, William. I think the message that we learned through this pandemic that we're experiencing is that number one, I think communication really prevents a lot of problems, and the second thing I'd say is that the availability of PPE and the protection of staff is paramount. And from the very beginning, we said that we needed to have the full PPE if we were to do a procedure. And fortunately for us, we did not get hit by the surge. And so therefore, we had a good availability of PPE, that we were able to use it when we needed to, without feeling that we were putting ourselves at risk. And I think to that, we're very fortunate.
Thank you.
Well, William, I think to me, when I look at it, I think that I just want to end with being philosophical. I'm sure a lot of things has been said in the past, but certainly life has changed, and it's not going to be the same as what it was before. But we will survive this, and life will go on. We just need to have lots of patience. We need to be strong, and we need to work together and stay safe.
Thank you for these encouraging words and words of hope. Thank you for joining. We'll stay in touch. Thank you.
Thank you, William.
Thank you. Thank you,
Stay
William.
safe.